So hi Tara, it's great to meet with you again as your genetic counselor. Again, we want to meet every month and discuss maybe some topics that you want a little bit more clarification on so that you can talk more productively with your clients. And looking back, I see that you mentioned that you wanted some more detail or clarification regarding our ATG lab or our Ambry Translational Genomics Lab and exactly what we're doing there to classify variants of unknown significance. So what I kind of want to have a little talk with you about is a lot of our clients, it's really important that they know what we do at our ATG lab and they understand the importance of that. But it's also key not to get into the weeds with it with most of our clients. If you've got some genetic counselors that really want to talk technology, then go ahead and bring me in. But what I want to give you is some basic knowledge that you can apply at the majority of your visits to show the value that we provide with our testing at Ambry. So when we're talking about, I'll give you a little brief introduction or review about variant classification. So I created a little whiteboard just to highlight some of the points that we're going to talk about, and I'll send you a slide for this so that you can keep that with you. We've got different tiers on how we classify variants at Ambry Genetics. The main tiers are we can report pathogenic mutations, that it's a variant that's likely pathogenic, or a variant of unknown significance. We also have variants that are likely benign and benign, but obviously we're not quite, reporting those as much. So the area that I want to focus on is the variant of unknown significance, or the dreaded VUS. That poses a lot of issues for a lot of patients, clients, and even Ambry, because our clients don't know exactly how to manage patients when they receive a variant of unknown significance. But in addition, patients don't get the relief that they want or the confidence that they need from this result. So at Ambry, what's important to relay to our clients is that when it comes to variants of unknown significance, we are definitely the innovators. We're there to, find answers for our clients and our patients. And, remember how we talked, at Ambry, a patient and their sample, it's a sample for life. We don't quit until we find an answer, and that we can help our patients, get the confidence they need and give the confidence to their provider to manage them appropriately. So I'm gonna make this super simple for you, and hopefully this will help you out in the field. Let's take a look here at kind of the process at Ambry. So at first we run the Ambry DNA NGS test. And a lot of times, few times we get a positive, a lot of times we get a negative, but many times we actually detect a VUS. And at that point, some of these variants of unknown significance can actually go to the ATG lab for further testing and further review. There's 4 main types of variants of probably unknown significance that we actually take further looks at when it comes to the ATG lab. Those are splicing VUSs, gross duplications, missense VUSs, and some negative cases, which I'm sure might be a little confusing for you now, but we'll definitely go into further, review of that so that you have this information for your clients. So we perform functional assays on all of these variants of unknown significance. And to make it simple, when it comes to a splicing VUS, we perform RNA studies. And what it comes down to is when a VUS is received that actually qualifies for RNA studies at our ATG lab, we actually send in the result, the provider and the patient, a notification of this. We do require a new sample because this time we are looking at RNA. But just to give you kind of an idea of how well our functional assays help us to classify variants of unknown significance, either to being pathogenic or benign for our patients, is we looked at 1,000 patients, 100 different variants, and with regular DNA studies, we found a 92% VUS rate. But after RNA studies, the VUS rate dropped to 8%, and 40% of these reclassifications were to VLPs, and that's to variants that are likely pathogenic. So you can see how well these functional assays, especially RNA studies, do work in helping us reclassify variants of unknown significance when it comes to splicing VUSs. When we move on to say, to make this simple, when we're looking at gross duplications, we do use a process of an assay called tandem analysis, and there's two points to this. We do DNA breakpoint as well as tandem RT-PCR. I know this is a lot of knowledge and it might not be applicable to all your providers, but I just want you to have this knowledge so if it does come up, you can have a productive conversation. Similarly, first of all, I want to mention that we are the only lab that's offering this tandem analysis for gross duplication. So that's something that you can definitely mention to a lot of your clinicians. So just like I mentioned with splicing VUSs, when we perform this, DNA breakpoint and this tandem analysis for gross duplications, we saw at first with just DNA studies, we saw a 92% VUS rate, which was reduced to 35%, and 60% were then raised to actually being pathogenic mutations. So again, even with our functional assays for gross duplication, we are definitely reclassifying and finding answers for our clients and for our patients. And then we also look at, another variant of unknown significance is the missense VUS. We can just kind of brush over this, but we do BRCA 1 and 2 functional analysis to help bring clarity and to help reclassify. But what I wanted to kind of focus on, because it's a little new, is even negative cases do end up at our ATG lab. And right now we're performing RNA next, and it's kind of a little bit in the research phase. But with RNA Next, we're identifying variants that we wouldn't be able to identify just at looking at the DNA level only. And we're really using this testing for patients that actually have a negative result on germline, but we still have a high clinical suspicion due to strong family history and phenotypes. So just so you know, there's a lot of success in reclassification with these negative cases. They yield a diagnosis of 10 to 35% in negative cases. So we were able to give an answer when we felt that something was a little off and that there was really something there. In the RNA, we are able to provide the client with a much more accurate result with our RNA Next assay. So that's just a pretty brief overview of what we do at the ATG lab and what makes Ambry so different from the other labs that are out there. We perform these functional assays and we attempt to give the best answers possible. So you can just summarize for your client, and I wrote them right down here. There's a lot of benefits to Ambry's ATG lab. And again, remind your client that we are the innovators, that we are the lab that actually performs these studies. A lot of other labs are just waiting for other studies to come out so they can possibly reclassify some of their variants. But we are being proactive and performing these studies on our own. So some benefits to the client is a reclassified VUS makes it much more clear on how to manage their patient, and it removes a lot of uncertainty and confusion. So, we can actually, if we're able to provide a VUS that actually is reclassified as likely pathogenic, our clinicians can manage their patients appropriately, or if it becomes benign, they can let their patients know that that it's been downgraded to benign. There's a lot of benefits to the patient too. Our patients do have a lot of anxiety when it comes to genetic testing for hereditary cancer. So, our patients can have comfort in knowing a true result perhaps. And actually, we can actually look at the family now and say, okay, there is, a pathogenic mutation or a variant likely pathogenic. So we want to monitor family members and inform them of this information as well. And then finally, the ATG lab actually benefits Ambry as well. And like I mentioned at the beginning of our conversation, it highlights our values. We definitely are the innovators, and one of our priorities is definitely great customer care. So again, we're the innovators. We're the first to perform many of these functional assays. We're doing it ourselves, and we're providing answers for our clients. So in addition, just as on the Ambry side, operationally, it reduces a lot of VUS rates and increases our efficiency at the lab. So hopefully going over a little bit of the basics of variant classification and the functional assays that we perform on different VUSs at the HEG lab, and the benefits, of course, that's the most important, that the HEG lab provides our clients. Hopefully you feel a little more comfortable in having these conversations. But just remember, I'm always here for you if those conversations get, a little deeper than you feel comfortable. But again, I thank you for your time this month, and I look forward to talking to you next month. Okay? Have a good day.